All right, so thank you guys for coming today. We have Jason Hurd. He is one of our amazing fellows. And he not only is a fellow on the unit, but he's also a burn survivor, which is, what are you, like one of two attending? Well, soon to be attendings.
Yeah.
That's a burn survivor or something. So it's pretty special, and to have that connection. So I will just turn it over to Jason and he can start.
Perfect. All right. Good afternoon, everybody. Like Lauren said, my name's Jason. Feel free to call me Jason. And thanks for inviting me. This is awesome. I was at the University of Iowa before, and we didn't do anything like this, and this is such a good idea. So I have a little presentation today. It'll last maybe 10, 15 minutes, and then we can have time for discussion or any other questions you guys have. And feel free to interrupt me at any time during it if there's something I say that doesn't make sense or you want to ask a question about something specific. So first, who am I? I was born in Urbandale, Iowa, a suburb of Des Moines. Most people can't pick Iowa out on a map, so there's not a test, but I am from Iowa. I did my undergrad and medical school at Iowa. Did my first year of training actually here at UC Davis with Dr. Greenhalgh and Dr. Palmieri and Dr. Sen, and then went back to Iowa to finish my general surgery training. So now I'm a board certified general surgeon. And now I'm doing burn critical care, obviously here at UC Davis, and then taking care of children at Shriners. And I was fortunate enough that they've offered me a job to stay on afterwards. So come October 1st, I'll be one of the new burn attendings here at UC Davis and at Shriners. So why do I care about burns and burn surgery? This is me. When I was 12, I had a 40% TBSA burn. I was playing with fire, poured gas on it, and the gas can exploded while I was holding it. I had several skin grafting operations. You can see my right ear was burned pretty badly, and I had some reconstruction of my ear. And I've also personally been a patient with laser. So I've had 2 different types of lasers used on my burn scars with good results. And so that's why I want to talk to you guys about it. Scars are obviously very relevant to burn survivors and burn physicians, burn nurses, everybody. We all, our goal is to reduce the amount of scars that patients have, but inevitably we all that have been burned have scars. And I don't know if you guys remember, but when we're taking care of patients while they're in the hospital, we're almost guessing with expert opinion if we think something's going to heal in 2 to 3 weeks. If we can get something to heal within that 2 to 3 week window, it usually will heal without a scar. But when it's not going to, that's when we pull the trigger and do skin grafting surgery. There's a lot of studies looking at scars. I just summarized some of it. About 30 to 90%, huge range of burn survivors, have some degree of hypertrophic scarring after a burn injury. And there's a table over here on the right side. Sorry, it's small print. But it just kind of outlines the different type of scars that we see. Mature scars are the flat scars that you see that are the ideal after a wound, is to have a mature scar, light in color, flat, really pliable. And then as you go on to the hypertrophic scars, are the ones that are thick, rope-like. They stick out above kind of the flat surface of your skin. And then there's the keloid scars, which are scars that extend beyond the borders of the original wound. So if it's growing out almost like a tumor is what I think of when I hear a keloid scar. And then the one I skipped over was the immature scar, which is when it's kind of early in its process of healing. And those are, I don't know if you guys remember, but when the scars are more red and raised and itchy, those are the immature scars. Scars are more likely to form in areas of high movement. So areas that I see a lot of bad scarring, even if it heals relatively quickly, are on the chest because it's constantly moving while you breathe. Shoulders are another common one. Necks, around the mouth, just because it's constantly moving. Higher risk for scar formation. For people that do get skin grafting, kind of along the seams or the edges of where 2 grafts meet, or at the edge of, if you have a graft adjacent to normal skin, are areas that are also more likely to form scar. And then the choice of what kind of mesh the surgeons use in the operating room. So the mesh pattern helps expand. Like when we take a skin graft, if it starts this big, when we mesh it, we can make it bigger to cover a bigger area. And based on how much we mesh it, this ratio, the 1 to 2 versus 1 to 3, 1 to 4, 1 to 6, is just how much more we stretch it. The more we stretch it, the bigger holes we punch in it, the more likely you are to form scars in that meshed area. Why people scar, believe it or not, people have been studying this for hundreds of years, and it's still not completely understood. We know there's actually these cells called fibroblasts that help put down collagen and help contract a wound in. But why one person has terrible scarring and another person has no scarring, it's still not well understood. There's really no difference between men and women in scarring. But what has been consistently shown, just looking over the years, is people with darker pigmentation are more likely to scar. But that doesn't mean someone who is black is going to have a worse scar than someone who's white. It's just the pattern that we've recognized. And then there's definitely a genetic component. If someone has a family history of severe scarring, their children, their family members are more likely to have scarring. But again, you could have a mom who forms terrible keloids and a daughter or son that has no scarring. It's very variable. And then a little bit of how we treat scars. Prevention is the best way to prevent scars. That's why whenever we get a new patient in, it's kind of like the clock starts. We got to make sure their wounds are going to heal in that 2 to 3 week window. And if it's not going to, we intervene. We do a skin graft to prevent bad scarring, which can be functionally limiting. I don't know how many of you wear pressure garments. I did for a little bit. It was controversial when I was a patient. So one of the burn attendings wanted me to wear them, the other one didn't, ripped them off every time they came to clinic. So it was controversial. And believe it or not, the data is contradictory. We use them in all of the children at Shriners and some adults on the adult side. And it's well supported. Most burn centers use them, but the data, if you look at the raw data, it is contradictory. Some say the pressure garments help, some say they don't. I'm a believer in pressure garments. Silicone sheets is another thing that's well supported in the literature. After the wounds have healed, it's literally just like a sheet of silicone that you put on and you wear it. I tell people to wear it 24 hours a day for the first few weeks, and then you can back off to every 12. And this is more studied in like surgical scars, not necessarily burn scars, but we extrapolate and use it for burn patients. And then I think the thing that's the hardest to do is time. I don't know if you guys remember, but when you're in the hospital, everyone says like, this is not what your scars are going to look like when it's all said and done. And I remember mine were red, ugly, raised, painful for 6 months after I got out of the hospital. And they really did kind of flatten out, and the color did change over the next 6 months to what they look like today. Any questions so far? Okay. And then how can we treat a scar that's already there? Or sorry, a little bit more about prevention. I forgot to mention this, scar massage. We definitely use it more here than at Iowa where I did my residency. But scar massage is well supported in the literature. There's at least 8 different studies, variable quality, but they all show improved scar characteristics when scar massage is implemented. They kind of fade away after the first year, but so scar massage is definitely something that can help flatten out immature scars. And then things that I use when I treat patients is steroid injections, triamcinolone, which is just a type of steroid. It's a really high potency concentrated one that we can inject directly into a keloid or a hypertrophic scar, usually every couple of weeks for 6 months. And again, it's not really been studied in burns, but we do it and it does show improvement. But obviously this can only be used in a small area of scar. We can't inject steroids on someone's entire body, otherwise it would be too much steroids and you would have side effects. But if someone has burns everywhere, but just one area that's really thickened and hypertrophic or keloid, it's expanding outside of the original burned area, then this is a good option. Something I've never done, but while I was making this talk, was looking up verapamil, which is a blood pressure medicine, a calcium channel blocker, and 5-FU, which is actually a chemotherapy drug. Injecting those have also been shown to show improvement in scar. And then the real reason I was invited to talk to, or that I wanted to talk about today, was lasers, which it is exactly as it sounds. It's a focused beam of light energy that we amplify in a machine and we shoot it at scars. There's 4 main types of lasers that we use in medicine, and there's really only 2 that are relevant to burn patients or people with scars, and that's the pulse dye laser, or you'll hear people call it PDL, and fractional CO2 are the 2 main lasers, and I'll talk about each of them. So PDL, pulse dye lasers, there's no test, but it uses the 585 to 509.5 nanometer wavelength, and I'm just going to go back, and I do have a on the top right corner here, you can see it's in the visible light spectrum. It's close to the 600, so it's kind of in this yellow orange region of visible light, the pulse dye laser wavelength. And what it does is it targets hemoglobin, specifically hemoglobin in capillary beds. And so it's really good for red erythematous or kind of inflamed looking scars, immature scars. And the studies, when it's been done, also when you not only helps get rid of redness, but it actually can decrease itchiness and improve pliability objectively when people are looking at scars. This one can be done without sedation. I've had pulse dye laser done on me, and I did it with topical like lidocaine. It's called Embla cream. I was able to get it done topically. It feels kind of almost like a little pinch, and they do it. I don't know. I probably had 100 little pulses. It doesn't feel good, but you can tolerate it without sedation, and you usually have about 3 to 6 treatments before you start to see results with it. I always warn people when they get it is on the bottom right corner. It does cause some bruising, and it initially looks a lot worse than what you started with, but that fades away with time. And as those kind of bruised areas fades away and the scar reorganizes, and the color fades, it's a lighter color than when it started. The top right example, you can kind of see, usually when people put pictures in their research studies, they pick the best response. But you can see that this person had significant decreased redness after pulse dye therapy. And then the other laser is the CO2 laser. And you'll hear it, there's a lot of names for it: fractional resurfacing, fractional CO2, CO2 alone is a newer laser that we're using. PDL was around first, and then CO2 laser. And what the CO2 fractional CO2 laser does is it creates these microscopic columns in the burn, in the scar itself. I have a video that I can show if people are interested, but it literally, you just have to imagine like almost like a fence post, like putting a little holes. We put 100 of these in every scar every time we fire it. And they're microscopic, 70 to 100 microns wide. And for a reference, 1,000 microns is 1 millimeter. So this is maybe 1/10 of a millimeter wide hole that we put in, hundreds of these that we put in the burn scars. And when people have looked at like under the microscope and at different proteins and factors that change after treatment with this, is in summary, it turns on a lot of good wound healing regulators that reorganize scars in a functional and healthy way, and turns down some of the inflammatory and negative mechanisms of healing that were there during the initial burn injury when we're trying to heal a big area. And so the result is you get a remodeled scar that's flatter, better texture, and more pliable. And this, I've also had the CO2 laser done, and because it helps kind of reorganize and soften scars. If someone has a little bit of a contracture, CO2 laser can sometimes get them to the point where it doesn't pull on their finger as much, or for my case, pull on my chin as much, without needing a surgery like a release in a skin graft. This can sometimes help people avoid those. Another thing that's really helpful with this CO2 is all those, you can imagine those hundreds of tiny little holes that we poke in the scar with it, is the steroids that we would normally inject into the scars. We can just put it right on top and it seeps into those holes, and again, turns down some of those negative healing mechanisms to get a healthier scar. This one is definitely much more painful than pulse dye laser. You want sedation for this. We do these lasers at Shrine right now. And we give the kids a lot of sedation for it. They definitely wouldn't sit still for it. And it requires about 6 to 10 treatments for the best results. Usually people don't see the results after the first couple, maybe treatment 3, 4, and people will start to be like, wow, I really noticed a difference. And then you do it every 4 to 6 weeks to get the best results. And here's some examples too. Again, they probably pick some of the better examples, but you can see kind of that hypertrophic, it's that thick rope-like scar that's elevated above the flat skin, and then after the treatment, it looks a lot flatter. And if you were able to feel it, it would feel less firm. It'd be more soft and pliable. In last resort, so say lasers, all these things aren't working, it'd be sometimes we do have to operate on people when the scars are impairing their ability to use their hand, to lift their arm up, to move their neck, if pulling down on eyes, and the lasers can't handle it, can't take care of it enough. We do surgery for scars. Sometimes if someone has a really small scar and enough other skin, healthy skin next to it, sometimes we can just cut out a scar and close it. You just end up with a linear, like one little straight line scar. Other times, I don't know if anyone's had Z-plasties before, but we essentially rearrange the scar, break it up, and bring in some healthy tissue into parts of it to help improve mobility. And then something that we don't do very often is something called resurfacing, where if you have a large area of hypertrophic scar, if the neck is like the most common, you can really cut out all of the scar and then do a new skin graft onto that area. But when obviously if someone forms scar the first time, they're still at high risk for forming more scar again the second time. And so we do everything we can to prevent a recurrence of the really bad scarring. So in conclusion, we all have scars. Burn survivors, non-burn survivors, we all have scars. Some people scar worse than others, and unfortunately, we really don't know why. And there is ongoing research looking into it. I hope one day we can make it so no one has scars. But until then, we just keep doing the treatments we know how to prevent them and procedures we know how to improve them. I'm sure some of you have the question is, how can I get this laser if I want it? We don't have these lasers available at UC Davis right now. I know that it's been a work in progress for a while, and COVID and all the other problems facing healthcare have made it a little bit more difficult. And I meant to reach out to Ketty, she's a nurse practitioner in our clinic, because I know that we've referred people out sometimes before to get laser done. But my hope is that we'll have laser at UC Davis within the next year. I think, yeah, that's the end of my presentation. Feel free to ask questions, comments. It doesn't even have to be about scars or lasers too. We can discuss whatever you guys want.
I'll kick us off with the questions. So one that I was wondering is, when is a good time to do lasers? Do you need to do it as soon after your burn as possible, or can someone do it when they're 5+ years out of their injury?
Yeah, oh, good question. So I would say a few years ago, we would have said the earliest you should ever do it is a year out from when you've healed, to give your body the most time possible to see what your body would do with the scar. And we can do laser therapy we could do it 5, 10, 15, 20 years after, and it would still work. But new studies are starting to show, and some burn centers are starting to laser people 3 to 6 months out from them being healed, and with better results than if they had waited the year. And so I think there's a kind of a paradigm switch where we'll probably end up start lasering people really early after their burns to reduce, especially if people are developing signs of poor scarring and hypertrophic scarring early. The studies and the literature right now is pointing towards earlier laser. But yeah, it's a good question.
Excuse me, Jason, kind of more of a comment, but it was kind of shocking to hear about the pressure garments. I feel like within our support groups, especially, from burn survivors, and I mean, you said as well, but it's always like pressure garments, pressure garments, pressure garments. So I never realized how like controversial that was. Interesting. Yeah. That's basically all I wanted to say.
Agreed. Every time I look at the literature too, it's really hard to study pressure garments. And anecdotally, when people wear them, they get better. But it's hard because everyone is burned in a little bit different way. Their body shaped a little different way. And how can you really tell if you're giving uniform compression to the entire scar? How can you really tell if they're wearing them 24 hours a day or if they're only wearing them 20 hours a day? That's so hard to study. And I don't think there will ever be a good study that's going to say 100% pressure garments work. But based on all the evidence, expert opinion, and what we've done over the last 10, 20 years is wear your garments. They help. I might not ever have a study saying you should 100% they help, but 99% you should wear them.
Thank you.
Yeah.
Jason, I have a question. So yeah. I've never met a doctor who is a burn survivor. So nice to meet you.
Nice to meet you too.
I'm somebody who's a burn survivor of 50+ years. So would I even be a candidate for something like that? I haven't had, my last time I had surgery related to my burns. Oh my God, now I'm really dating myself. Almost 20 years ago. So I can't believe I have to say that. but it was. So I didn't know if that would even, like, I think the older I've gotten, the more I think like, am I even a candidate? Is it even something that I should consider? Or is that not even an option for me? Does that kind of make sense?
It does, yeah, it makes sense. And it's definitely an option for you. And when I'm seeing people in clinic and talking about laser or any reconstructive procedure, it's not so much like I can be like, oh wow, this person definitely needs their arm released. This person definitely needs laser. It would look so much better. But if it's not bothering you, if it's not functionally limiting you, and you don't want it to look any different, then don't even entertain the idea of it. But if there's something that is either cosmetically, you just think it could look better, it could look flatter, less red, or I really wish my eye didn't get pulled down when I sleep, or I really wish I could lift my arm higher, I can't play golf anymore, then
Right.
yes, and we can help you.
Okay. Because I think
Does that make sense
for
to
me,
you?
yes, I just think for me, sometimes it's like with my eye, like one eye just slopes down lower. And then on the left side of my face, it's more kind of ripply. As I've gotten older, it's actually smoothed out. I was like telling my mom, I was like, oh my God, I think the older I've got, I think that's, I don't know if that's a plus with aging, but I'm gonna go ahead and say it's a plus with aging. But
Yeah.
my scars have, I mean, they've changed. It's just flatter, but I think that's because I'm also older too. But it's still ripply, and I didn't know like if laser would be something that I could consider. That'd be like that would make it less ripply. So
Yeah,
okay,
yeah, potentially, and we would have to take a look at it and see exactly what the
okay,
scar felt like and how much benefit you might get from it. But I think definitely, I don't think there's no time. I would say even if someone's 100 years out from a burn, I wouldn't say there's any time where it's too late. You might not get as good of a benefit as someone who did it earlier, but that doesn't mean you
right,
wouldn't get any benefit. Yeah.
okay,
And I know what you mean about
awesome.
getting older. I have a bad scar across my chin here, and I'll never need a chin lift ever. My scar will keep my chin up.
And I see sometimes there's some pluses and minuses, but
Yeah, I
thank
agree.
you.
Yeah, you're welcome.
Anyone have any more questions or even unrelated to laser?
No, you already answered my question before we started, so I'm going to follow up with, because I have Kaiser's, I don't have UC Davis, so I'm going to see what other
Yeah.
options. But
Yeah, see what they have.
I also have a ropey cord between my breast area that's really tight, and they suggested wanting to inject that with steroids to loosen it. So, I mean, that's one option they gave me for that, but my hand, they actually wanted to do a release. So
Yeah, I would guess the release would probably give you the most bang for your buck. And it would be a quicker, you would notice the effects right away and get you better use of the hand right away. Whereas the laser, we'd have to try it several times, which is going to take 2 or 3 months before we really know if it's going to help you that much.
great. Okay, thank you.
Yeah, you're welcome.
Kind of related to Cindy's question, some folks I know would wonder what insurance coverage is like for getting laser treatment.
Yeah.
Do you have any insight into that? Our insurance is covering it at all?
So I know some are, and I know some don't. It's a lot easier to get coverage for burn scars because it's not a cosmetic thing. It's more of a functional thing. It's either pulling on your eye, pulling on your lip, making it so that you can't move very well. Your skin's not pliable enough to do normal human function. When we do it right now in kids at Shrine, it's easy because everything's paid for by the Shrine if the kids don't have insurance. So lucky for me, I don't have to worry about it in the kids. But as we get laser at UC Davis, obviously we'll have to figure that component out. And it's really about how you label it, whether it's functionally impairing. And it's not a cosmetic surgery in burn patients. It's a functional surgery, and that's why we get it paid. When I was at Iowa and did laser as a resident, there was a lot of adults getting it, and insurance paid for it. And we'll figure it out. And there are fortunately other people that deal with insurance. I'm glad I don't have to. But I will get involved if they're declining our patients laser surgery. We'll get involved and help it get done.
Awesome. Thank you.
Well, we have just like 3 more minutes, or we can end here unless anybody has anything else for Jason.
I do. I just have a personal question.
Yeah.
So,
Go for it.
Jason, since you are a doctor and a burn survivor,
Um,
and you can answer this if you want to, if you feel comfortable. Did you decide on becoming a doctor after your injury, or were you already like, I'm going to be a doctor
yeah,
early on? Did you know that early on? And how has that
I
helped
had,
you in your journey as a burn survivor?
oh, awesome. Thanks for that question, Judy. I had no idea what I wanted to do when I was 12. I was obviously a kid that played with fire, did a lot of dumb things, had a lot of fun. I knew after I was burned that I wanted to help other burn patients in some way. And I got bad grades when I was younger after my burn injury. I kind of got my act together, started to get better grades, studied more. Really was like, I want to be a burn nurse. I want to do research, something in that field. And then eventually, as I started volunteering on our burn unit, back in Iowa, I knew that I wanted to help burn patients and physically take care of them. And I got good enough grades to go to medical school. And I was like, I'm going to be a burn surgeon. And it definitely shaped my path. I have no idea what I would have done if I hadn't been burned. There's no way I would be a burn surgeon. So no, it definitely shaped my path. And I think it helps me take care of patients better. I can empathize a lot more. I remember hearing patients or survivors all the time say, to nurses, you have no idea what I'm going through. Finally, when they say that to me, I'm like, I do, and we'll get you through it, kind of thing. So I feel like it makes my voice a little bit more heard since I've been through it too.
That, and then it's also nice to see, because I know sometimes when you're depending on where you are in your journey, sometimes you can't see yourself so far out. And so
Yep.
I know for me, a lot of people are like, oh, I didn't like, they're always surprised that I was in retail management for a long time. And people are like, wow, you're like, yeah, I was like, yeah, in front of people all the time. Like sometimes it's just hard to see themselves outside of like when they're not in the hospital anymore, when they're not doing rehab, and to be, I guess, further along and like, yeah, I'm doing what I want to do and it's possible. And so it's just nice that there's like, my mom is always a firm believer. If you see it, well, she's somebody, if you don't see it, be it. So it's nice
Yeah,
to say like,
exactly.
there's somebody, you know, like, cause I was like, I don't know if I'm necessarily going to see myself. She was like, well, then you got to be the person you want to see. So
100% agree.
Side note, we love Judy's mom. She's amazing. And it's kind of a long story, but she was actually like a float burn nurse. She was a float to the burn unit. And that's how she got Judy involved with like peer support. So just kind of
Oh,
a
that's
fun
fantastic.
roundabout way. But
That's awesome.
yeah. All right. Well, thank you so much, Jason. We
Thank you.
know that Jason's going to be more involved once he's done being a fellow,
Yes.
because I'll be knocking on his door.
You know where I am.
But thank you very much.
Yeah. Thanks, everybody.
thank
Bye.
you. Have a
everyone.
good one, everyone.
Bye.